Hi everyone, I am Captain Roy Villalobos with the Army Medical Department. Thank you so much for tuning into our very first story and case study with Army Medicine virtual event. Unfortunately, we started the recording a tad late, so I will conduct a quick introduction of Dr. Zachary Brooks, as well as cover a quick synopsis of what you have initially missed in the discussion. Captain Brooks is a recipient of the U.S. Army Health Professional Scholarship Program, which means that the U.S. Army Medical Department covered 100% of his medical school bills and tuition. He also explains how he received a monthly stipend and a $20,000 bonus. He goes into details how he was never financially burdened throughout all of medical school and how he could primarily focus on his studies and the examination during his MS4 year. He was fortunate enough to get his first pick of psychiatric medicine, and he's currently now a PGY4, so a fourth-year resident at Walter Reed Military Treatment Facility out in Bethesda, Maryland. He briefly discusses his Army medical training that he received out at Fort Sam Houston, San Antonio, Texas. He shows some photos with fellow peers and colleagues, other residents and attendings, other healthcare professionals, and now he is currently discussing a rotation that he had at Tripler Hospital in Honolulu, Hawaii. That is where we are currently in the recording. So let's jump right into it. I hope you find the information intriguing. I hope that you're able to piece together the similarities and differences between Army medicine and medicine within the private sector. If you ever have any questions, please just feel free to reach out to me. You have my emails, that's how you receive this video. So without further ado, let's jump into it.
And then it was 3 weeks of being in the field, and so there was some staying in barracks and stuff like that for a few weeks. But for the most part, it was kind of similar to being a medical student. But I was off on the weekends, and so we'd go into San Antonio or go into Austin. And you definitely do not need to shave your head or buzz your head like I did. You could just have a normal haircut. But that was kind of the level of knowledge I had, but it still worked out fine. So I have a few pictures here kind of wrapping up med school, starting intern year, etc. So on the left is a photo of me in Hawaii. So when you are a fourth year medical student, they will pay for you to do a few away rotations. So you kind of do them at whatever sites you're interested in. For psychiatry at the time, there were two programs in the Army. There was Hawaii and Walter Reed. And so I had this picture both for two reasons. One, because I am someone whose hobbies are mostly involving watching Netflix and being indoors. So this picture proves that I have been outdoors at least occasionally. But also the fact that, they paid for me for a month to go to Hawaii and do a rotation, and I got active duty pay during that time, which is more than you get the rest of the time in med school, and pretty great experience. This is me, kind of my badge I got right when I was starting residency. And then this is one of my co-residents. She's a year ahead of me. She also went to Campbell, so we were kind of featured on our school's Instagram page, just kind of talking about both being military medicine. Some kind of unique aspects that I didn't really know about, but have been pretty cool to experience is that, the military does these challenge coins, and you can get them, if you're, somebody thinks that you're doing something very well, or you kind of just happen to be in the right place, right time. One of these, the one in the middle, the Walter Reed one, I got from a poster competition. And then the Joint Chiefs of Staff, General Milley, and the Senior Enlisted Advisor, I got while working Thanksgiving as an intern. I was just in the hallway at Walter Reed, and this big crowd of people came and essentially got these coins. And I thought it was very cool, but again, I did not really know that much about it because I'm not prior military. And I showed some friends who are maybe went to West Point or the Naval Academy or have been in for a long time, and they were stunned and jealous that I got these great coins. So it's kind of a cool little experience that I've had, and just something that I definitely would not have had not being in the military or at Walter Reed. So it's a pretty unique experience there. I also included some pictures here from the APA over the past couple of years. So been able to present, been able to do posters, stage presentations, etc. And the military has paid for me to go to them. For the most part, essentially, if I've gotten anything accepted, they've paid for me to go to a conference. And so these are just some, snapshots of that. And made honestly truly great friends from the shared experience of both being a resident and being in the military is something that I think really bonds people. And so it's been a really great time. And then just as like our end of year annual conference that we do for the psychiatry, and just kind of essentially just in some regards, yes, we are in the military, and which is very nice. And I'm getting resident pay plus housing pay as a resident, which is pretty great. I have friends who are civilians also in DC, and we make about the same amount at baseline, but then I also get a housing stipend based on the region where I live, which is tax-free. So in addition to making about the same as what the residents in the area make, I also get an extra about $2,700 a month, which is tax-free, which pays for my apartment. So that's over $30K a year, which is really nice during residency when most people are making around 60, to have that kind of extra 30 or so tax-free. Something I didn't know about as a med student. I had no idea about the housing stipend, and then when I got to residency, that was a pleasant surprise. But anyways, just some pictures kind of from the various APA and things like that. And then these are just some more pictures of my various co-residents and kind of some things we've done in the past year or so. And in some regards, yes, sometimes we wear the uniform to work or scrubs to work, etc. But it's just like being a resident anywhere else, and you make great lasting memories and friendships. And so these are kind of a group of people I could not have done it without. So just wanted to kind of include them here. But I think it's, again, I was not really sure what to expect. And in a lot of ways, you are a physician, you are a soldier, and those meld together much better and much easier than I kind of thought they would. And it's been a really positive experience. I'll have my disclosure slide later, but I'm not being reimbursed or paid, or I get no cut if anybody joins from this. They just kind of asked, anybody who might be interested in kind of talking about their experience, and I was happy to help. And I think that for me, especially with no one in my family having done it before, I really had no idea what to expect. And so far, everything has been very positive. And so I kind of wanted to just come today and be here to kind of, especially for people who maybe are in a similar boat, they're thinking about it, but they really don't know what to expect or aren't sure if that's for them, etc. To kind of just hopefully be a good point of contact, but also maybe just to kind of show that, just a regular pre-med nerd who went throughout school and happened to go into psychiatry, but also happens to be in the military too. And so it's been a really cool experience. Some other things that being at Walter Reed that have been really unique is the patient population. I'll talk about it a little more in the case, but I've seen in various settings, and I have to be like ours, but various VIP patients and unique patients in a variety of backgrounds, NATO, etc. So it's just kind of a unique situation that I definitely, being from Alabama, small town originally, I would not have thought I'd be in this situation, but it's definitely opened some doors, loosened kind of like the financial stressors a lot, and has been like a really positive time. That was like super fast. I realized that, but also I think I mostly just wanted to kind of start the conversation and see kind of what questions people might have about my time, thoughts that they might have, etc. And I will do my best to answer any questions.
Nothing yet in this chat.
Obviously, it's
Hey,
only
so Dr. Brooks,
yeah, go ahead.
this is Captain B. I do have a question in regards to, in comparison to your civilian counterparts, how did you see a major difference, especially when it came down to receiving that stipend? Well, first off, how much was that stipend, and was it actually beneficial? Did you receive a bonus or anything like that?
Oh, yeah, great question. That's kind of why I had the pictures, to try to jog my memory of some various things. So It's been a couple of years. Oh, sorry, my cat is here. It's been a couple of years, but when I was in, I believe after taxes, it was about 13 or 1400 twice a month. And that was after taxes. So I think it was around like 2,700 or so a month. I'm not exactly sure. That number might be slightly off, but definitely was a significant help. Depending on where you live, for me, especially in North Carolina, paid the rent, paid for, food, etc. And yeah, was definitely help. And then I think at my time I got around a $20,000 bonus. I'm not sure if that's still the same number, but I think that's what I was when I got it, which was also unexpected. And again, I was just going to do it to pay for school, and then the fact that they gave a bonus and paid for health insurance and gave a stipend during was a very nice perk. I think all in all, I calculated that probably just for my med school alone, it was probably at least $350K between what they paid me and what they paid the school. And that was being conservative. It might have been closer to about 400. They did not care where I went. I have a friend who went to Tufts and a friend who went to Tulane, one of the Army, one of the Air Force, and both those schools are over 80K, and they were paid for as well. So my understanding is if it's an American medical school, like continental U.S., that they will, maybe Alaska and Hawaii, I'm not sure, but like I don't think they're like Caribbean or anything like that. But if it's an American medical school and you're accepted, you're pretty much good to go. And that it made for me very excited because Campbell was my top choice. But if I had not had the scholarship, I would have definitely had to probably pick somewhere else, maybe a state school or something, because of that. Because I'm not fully sharing my screen now, I do have access to some of the chat. So thank you for people asking some questions. It looks like so someone asked about Masters of Social Work options. I'm not sure. I would have to pass the mic to Captain V on that one.
Yeah, for sure. And so when it comes down to I'm going to actually tie that in with another question that's here at the very bottom that states, what are the fields of medicine that you can choose for this program? Now, we have multiple programs, there's multiple incentives. If you are strictly asking for the scholarship, if you're applying to medical school, dependent on, not dependent, if you're applying to any accredited university, you can apply to the scholarship. Now, if you're already in residency, we have 41 specialties that we need within the United States Army. It's a pretty big portion. And so depending on your specialty, please just feel free to just send me an email and we'll see what opportunities are available for you. If you are if you're pre-dental, veterinary course specialist, so if you're going into veterinarian or you're a nurse, to include doctorate nurse practitioner, nurse anesthetist, CCRN, so on and so forth. We need those. Pharmacists, specialist corps, so optometrists, scientists, biochemists, social workers, psychologists, all these are needed within the Army Medical Department. Now, if for whatever reason I missed a certain specialty or career field within healthcare, and you're still curious about it, hey, put in what that job title is. I'll answer that question. Or once again, just send me an email and let you know what opportunities are there. Within medicine, though, there are so many residencies. And a really big myth that I hear about quite often, actually, Dr. Brooks, if you kind of cover it, how did you become a psychiatrist resident? Did the Army force that to you? Do you even have a choice? Or you pretty much could select any residency if you scored well enough for it?
Yeah, a great question. And I will say too, as far as like the Masters in Social Work, I wasn't sure about the specific scholarship, which is why I didn't want to answer. But I mean, we work in a multidisciplinary team just like you would in any other healthcare setting. And so I have worked with people from every healthcare specialty you can think of, things from, nursing, social work, pharmacy, optometry. And when I went to basic officer school, there was veterinary students, dentists, physicians, PAs, pretty much anything you can think of. Obviously, the military needs in some way, shape, or form, just like a civilian healthcare system. So I don't know the specifics of the physician pathways scholarships, but definitely talk to Captain B and stuff. They can help.